Right, so they're all coming in now.
Right, I think we'll make a start. Good morning, everyone, and welcome to our vaccination volunteer induction session this morning. If I could ask people just to pop themselves onto mute just for now. What we're going to do is we've got a number of colleagues joining us to present some slides for us this morning. So if we're able to hear them in full sound, that would be wonderful. And then what we're going to ask people to do is just to pop any questions that they might have into the chat box. And then at the end of the presentation, we will have a colleague just to chair a Q&A session at the end, just to make sure that if you have any queries or questions, either coming through the presentation or anything you've experienced so far, then that's your opportunity to get those answers for you today. So without further ado, my name is Lisa Bedding and I am the lead for the volunteer single point of contact that's being run by NHS Bedfordshire, Luton and Milton Keynes clinical commissioning groups. And they're the organisations that I work for. We've got a number of colleagues from Hertfordshire Community Trust joining us to make the presentation this morning. We've got Kirsty Simpson and Jamie Parson-Hames, who are both site managers for the site being run by Hertfordshire Community Trust. So they're really in the know about how the pods and the vaccination process is working. So that's what we're going to walk you through this morning. And then we've also got a colleague, Jane Trundle, from the training team, who is going to chair the Q&A session at the end. So in terms of where we're at this point in time, the volunteer bureau that I'm running is sourcing volunteers for sort of two elements of our vaccination programme. The community sites, which is what Hertfordshire Community Trust are the lead provider for. So they're running the community sites across quite a geography in the southeast of England, but it also includes Bedfordshire, Luton and Milton Keynes, which is the patch that we're looking at this morning. We're also looking at volunteers to give support at our GP surgery level vaccination clinics as well. So there will be some slight nuances between how these sessions run that are presented by our lead provider, Herts Community Trust, this morning, with what we'll see running through the GP clinic-based sessions. But all in all, this information this morning will be relevant wherever you may be placed moving forward. So what I'll do now is I'll hand over to Kirsty to walk you through the presentation, and then we'll pick up any questions at the end. Thanks very much. Over to you, Kirsty.
Lovely. Thank you, Lisa. So good morning, everybody, first of all, and welcome to our presentation from Hertfordshire Community Trust this morning. So really appreciate that you've all jumped out of bed, got your coffee and your breakfast down you, and decided to join us on this Monday morning. So welcome. And again, just a thank you to everybody who's showing interest in this programme, because quite honestly, without your support as volunteers, as a real glue point to this programme, yeah, the delivery would be quite different. So really value your time today being here. So without further ado, so as Lisa quite rightly said, so I'm Kirsty Simpson. So I'm Quality Improvement Lead here at Hertfordshire Community Trust. I'm a physiotherapist by profession and have been sort of brought into the COVID-19 mass vaccination programme as one of the site managers really for our pods. So you'll be also hearing from, you can see his name there on the screen now, but Jamie Parsons Haynes, who's also a physiotherapist, so double trouble in the room this morning. And he's also going to be one of our pod managers as well. So our names will become quite familiar to all of you, especially as you come on board with us. So without further ado, Jane, are you okay just to progress the slide for me? Perfect. So hopefully at this point we'll just do a quick check that everybody is here for the same purpose, that you haven't landed in the wrong place, but hopefully that you're all here expecting to talk about the COVID-19 mass vaccination programme. It should be of no great surprise, but this word COVID-19 has been kicking around far too long now. And between us, we all need to kind of rally to try and support vaccination, to try and make us all safe again and allow normal lives to start resolving, really. So basically, Hertfordshire Community Trust have been identified as the lead provider really across the east of England, but particularly across Hertfordshire, Bedfordshire, Luton, Milton Keynes. So we'll talk a little bit more about the demographical areas shortly, but we have been nominated to be the lead provider. So it's a national programme, so it's not something that we've sat in a dark room and written. We are following national policy and guidelines. So obviously our timescales of how things are happening are very much governed nationally, and we're kind of dictated to largely in that sense, really. So this programme is following different models. So you'll hear different things happening. So Lisa touched on some of them. So you'll have probably heard locally in your area, some of your GPs already delivering the vaccine and sending out contacts to people. So that's one model. Another model is getting into our care homes. So again, things like roving models where people are moving around and delivering the vaccine in that method. And then this is a different model in itself. So this is around community pods, essentially, to do large vaccination cohorts in larger spaces and moving large groups of people through. So that's effectively, if you're hearing about a pod, that's what we're generally talking about. And if you hear the word PCNs branded around, that's basically primary care networks, and that links really to your GP practices primarily, and our care homes. So in these pods, essentially, they're made up of different aspects, of course. So obviously we have the arrival of patients, and then we have making sure that we've got the right person here for a vaccination, and we haven't got people bringing all of their relatives in hope that everybody's going to get vaccinated at the same time. We have a clinical assessment area, which is really just nothing unusual. It's what happens with any injection that you will be going for at your GP at any time, but it's essentially to make sure you're safe to have the vaccine on that day and that you're consenting to it, quite simply. And then if both of those accounts are correct, you would go through into the area that delivers the vaccination itself, whereby we obviously have trained staff delivering the vaccine, drawing up the vaccine itself, and once people have had that vaccine, they move through into a post-vaccination observation area. So some of you will probably be familiar with this when you've had other medications or vaccines, but it's basically, in simple terms, an area where you're watched to make sure that you're safe, fit and well to carry on about your business as usual. And we do have some of our sort of more people who are showing an interest in doing some of the observation side there from volunteer aspect, who've done some of the additional training around basic life support, observing those patient groups and working with the clinical staff if they had if there is a problem arise, which obviously we're not expecting plenty of. Obviously, from a clinical staff perspective, you'll see that we have areas in the pods to manage any adverse reactions. So if there was an anaphylactic shock or if somebody was poorly, again, just to reassure you all, these are, like with any vaccine, expected in very, very few numbers, but we obviously are safely managing that by having access to all of those resources within the pod itself. We're health, so it's of no surprise that we follow social distancing, and we work by a 1 metre rule once you're in the actual clinical space itself where the vaccine is delivered. And that 1 metre is really, again, to try and put some distance there. But of course, we can't have levers work by operating levers and robots to deliver vaccines. So we do obviously have to come slightly closer than the 2 metre rule. But for yourselves as volunteers, obviously, we would be expecting in the roles that you're likely to undertake is that you would largely be able to adhere to more of a 2 metre rule where possible. And PPE, we provide all of that for you as being here, but again, we have surgical masks. We do have access to visors. So again, we have plenty of alcohol gel. We are not in short supply in the NHS here as part of this programme, so we would provide all of that for you. Just really simple things, sort of logistical aspects that our clinical staff will be responsible for, but just really to reassure you that this is quite a robust programme. We obviously have to take receipt and store the vaccine under the conditions set to us in terms of refrigeration and timescales. So we do a lot of stock control and something called cold chain management, which is basically how that vaccine is transported and maintained at the right temperature. And obviously we replenish the pod's resources as necessary, and these aren't tasks that we'd be anticipating you to be involved in any sense there. We have members of staff who will be responsible from an admin perspective for doing some of the record keeping, because obviously we need to keep track that people have had this medication and that they've given their consent. And then we do have IT support on hand for any of our technical errors. So yeah, there's quite a large, vast role and responsibility of our workforce, as you can see, and we'll kind of narrow it into some of those roles that particularly the volunteers will be associated to. So again, any questions at this point, just keep popping them up into the chat box. And as Lisa said, our colleague Jane Trundle from our Learning and Development team will be sort of heading up a Q&A session at the end of this for you. So yeah, please ask away if you're sitting on anything. Perfect, Jane. Okay, so we've covered this already, but just to say really that we are the lead provider across quite the expanse. So Hertfordshire, West Essex, Bedfordshire, Luton and Milton Keynes. So in total, we have a large number of pods expected, I'll say. So around 31 across the entirety of the area, but 18 of those across Hertfordshire and West Essex and 13 over the Bedfordshire, Luton and Milton Keynes area. So initially our first pod that will be due to go live will be our Stevenage pod as part of our Hertfordshire cohort. And as I've mentioned just a couple of bullet points there, we mentioned about this just being one model of delivery in terms of vaccination pods versus others that are associated with our GPs and care homes. Lovely. Okay, so what comprises a pod in terms of staffing? So there'll be a clinical manager. So for a clinical manager, they will be somebody like myself or Jamie, who you'll meet shortly. And also we have some of our members of staff from our immunisation team who are used to vaccinating children all the time, so they're quite familiar with this work. And then we have essentially 7 other healthcare professionals who would be on shift at one time. So we would have 5 healthcare professionals undertaking a clinical assessment, which remember is the consent and are you safe? And then we would have a band 5 member of staff who will be drawing up the vaccine to give over to the immuniser. And basically we also have a band 6, so don't worry about the bandings too much, it's just a seniority in skill set really, but there will be somebody overseeing and being a bit of a floor walker to make sure that everything is going as should be and reporting back and escalating to the management team accordingly. We then obviously have per pod, it's anticipated that we'd have 2 immuniser stations happening at one time. And then, as we've mentioned, we would have staff looking after people who have had the vaccine in our post-observation area. We also have a healthcare assistant who will be again helping with hygiene, cleanliness, and supporting the clinical staff if they were needing access to additional resources or anything. They also function for us to keep things going. We also have admin staff, so 2 basically looking at electronically documenting. So there's 1 per immunisation station who just work with the clinical staff to make sure the right detail is captured about the patient and delivery of the vaccine. And then largely where some of our lovely volunteers, you lovely bunch, come into play are our marshals and stewards. So thinking about inside and outside the building, both roles equally as important as each other, because from the moment a patient arrives on site at the barrier, we really need to be making sure that we've got the right person and helping that patient flow moving through to stop all our hold-ups and people waiting out in the cold or anything like that too long. So plenty of ways that we'll be supporting communications between everybody through use of radios. And if you were somebody who would be having a radio, don't worry, we've got a guy on site, one of our site managers, who will go through the key codes, and they've got cards that you would have to as a bit of a prompt to what you would do. But basically it's just very simply how we communicate to each other to make sure patients move through the system. Perfect, Jane. Thank you. Okay, so in terms of if you're a marshal, so if you're thinking about, and just to warn you, the terminology that the national team are using has kind of caused some confusion for people. So basically, normally when we think of marshals, we think of people being outside most often. If we think about when we've been to a gig, which is probably, you know, some years ago, it feels now. But marshals, with the terms that they're using are really thinking about inside, and stewards being outside. So don't get too hung up on terminology at this moment in time. We're going to try and think about our local terminologies so it all makes sense and we're all thinking the same. But essentially, I think all of these almost apply to both sets anyway, because whether you're outside a building or inside, you are primarily doing patient interaction. You are about making sure that there's patient flow management within the site, that you're supporting smooth arrival of people arriving on site and making sure that they're okay and that their experience is a good one. And then obviously you're communicating between your sort of next point of contact in the line if you've got a problem at your point, or you need to kind of hold people, slow them down, speed them up. You're a bit of a go-to person to help us with that aspect, really, and just make sure that people are abiding by safety markers. So, you know, no different to if you're going out into the supermarket and somebody gets too close and you feel uncomfortable by it. We're just making sure that people are wearing masks, unless they're exempt, of course, and that people are just respecting the national guidelines around social distancing. So you're just being a bit of a prompt for people if they're getting a bit too snuggy with the next person in line. And then obviously just thinking about if there were any security issues or concerns that you had, that you're communicating those through the radio so that we can obviously help address and deal with any concerns very promptly. And really, I think it's about patient identification. So if you think that there's, I don't know, a very elderly lady come, maybe she's late 80s, 90, looks very frail, obviously not going to tolerate standing in a queue for very long, for example, that you can help communicate that to the next person, or assist them to a chair, and make sure that we're aware of their additional need potentially. Okay, but yeah, I think it's just normal stuff. If any of you have been to anywhere really, be it, you know, John Lewis or a music gig or the theatre, you're quite used to the role of what marshals and stewards are doing. It's really just supporting people's experience and keeping people moving and keeping the system working, essentially, but fundamental to the rest of the thing working. So yeah, I can't stress how important you all are in this process. Lovely, Jane. Okay, so as we touched on briefly earlier, that obviously post-vaccine, people will go and have a sit down for a 15-minute period to be observed to make sure that they're fit and well. Obviously, we can't hold people against their will. It is a recommendation for their safety that we are there to observe them. But it's an opportunity just again to have that real patient interaction, make sure that that 15 minutes doesn't feel like a drag essentially. But your eyes, if you do have an interest particularly in this role, we just need to know, and just again for yourself, Lisa, because this role would carry an additional level of training need from a basic life support measure, which is no problem, we can provide it. It's just we need to obviously identify those that are going to be doing this role to make sure that you're equipped properly. But primarily it's about observation and identification that somebody needs some additional support, and you wouldn't be expected to primarily deal with that situation, hence why we have enough clinical staff in the room with you. But we would expect that you've got confidence in giving a loud shout that you need some help first and foremost. And yeah, maybe facilitating some offer of some basic first aid support, again alongside some support from clinical staff. And then the next role is really around admin support. So as I've said, it's really around helping us log patients in, make sure that they've arrived. We have databases and systems for that we're obviously using. So if you were interested and appointed to one of those posts, again, you would be familiarised with the ask of you at that point and the system that it entails. Okay, Jane. Lovely. Okay, so everybody kind of is very interested in what a pod looks like, and we've been fortunate enough before our tier 4 kicked in to obviously invite some of the volunteers into the pod itself to show them, but we didn't really want you to miss out on this too much. So these are national pictures on this slide. We're going to go through some photographs of our pod here in Stevenage just to give you a bit more sense of what it looks like. But very simply, if you remember back to your school days and going in for any vaccination at a school sort of setting, it's very similar. So it basically looks like an area that's not necessarily used for clinical purpose usually, now does look like a clinical setting. And it's spaced out as such following social distancing recommendations. And it's basically waiting areas, immunisation stations, and basically another almost waiting area, which is the post-observation space. But yes, just a hygienic space for a vaccine to take place is what we refer to as a pod. So Jane, if you're happy to move forward. So this again isn't our Hertfordshire community image. This is a national picture out of their documentation, but it just gets you just thinking about end-to-end user journey. So from the start of arrival through to leaving to go home. So stage 1 is really just arrival and check-in. So where we will have essentially front of house members of staff sort of meeting and greeting the patient, checking that they're here for the right reason and that they've got an appointment. They will then be let in through a barrier and into a car parking space that we will then have marshals allocated around to ensure that people are getting to the right location. At some of our sites, we will have defined disabled parking that we can obviously navigate people to closer to the door. Also, if you look, you'll see where it comes into stage 2 clinical assessment, the box that's underneath that. That's basically where you've got 5 people sitting, it looks like. That's the clinical assessment area. So where you've got the red dot underneath it, where there's a marshal, that's essentially coming into the front of the building. So another opportunity for a checkpoint that everybody's okay, that they're safe to come in. And then they come into this pod. You'll see in a moment, they come into another waiting area before going into the clinical assessment area. But at that point, that's really, are they consenting? Are they safe and well to do so? If the answer is no to either of those, the members of staff in there would utilise the database to document that accordingly to make sure that people either didn't get invited again for another one if they weren't consenting, or that they get invited again for a later date. And then they would exit back out the sort of entrance route, but following a one-way system. If not, where you have the 3 little people walking through what looks like a little tunnel, that's where you let in, if you like, into the vaccination space. And stage 3 there you can see is the delivery of the vaccination, and that is essentially a bit like the pod that you just saw a picture of, where you get a waiting area, you get an immunisation station, you go through to your post vaccine observation area, which is in the same room in some pods, a separate room in others, and then essentially where the red dot is at the end, there's another marshal just seeing people out of the exit route once they are fit and well to go. So just to put this into a bit of context, I'm just going to share a few slides with some pictures of our pod at Stevenage, just to give some better detailing there. So essentially, this is our entrance point. Again, whereas we're saying we would have members of staff meeting and greeting, a volunteer role at this point. And then the picture on the right-hand side is just looking from the inside out. So people will come in here, alco gel, and then we have basically a one-way system operating that would take them through into a waiting area. And if we go to the next slide, the picture on the left is essentially waiting space, and you can see the desks sort of on the right top hand side of that picture, and that's where we will have some of our admin members of staff, just again checking people in at this point. And then you go through a door and you come into our clinical assessment area, which basically you have multi-desks at this point, but on the far side of the picture you would have a qualified member of staff who would be essentially doing that checkpoint with the patient, and the white chairs being for the patients here. Again, this is the room that you're either leaving and going home. If not, you're coming into this space. Top left picture is basically the waiting area for the vaccine. Middle top image is basically where our qualified nurses will be drawing up the vaccine with the fridges nearby. And then the top right is basically an immunisation station. So you can see that you would have somebody sitting on the right hand side there, for example, with the laptop being your admin member of staff, and you would have a patient sat with an immuniser delivering the vaccine, and then a qualified member of staff overseeing that vaccine. The bottom two pictures there really are our observation area. So where we said there would be a volunteer role available with the extra basic life support training. And then the picture on the right is just an area for some clinical treatment if it was required. And we would have obviously all the relevant equipment there as well that the clinical staff may need. And then from there, essentially, you would go through a door which takes you back out as an exit into the car park space. So seeing lots of nods and smiles. So hopefully I haven't lost anybody at that point, and hopefully it's clear enough without physically being in our space. And just remember, everybody, this is obviously one of our vaccine pods of multi-site. So they will all slightly differ, but they'll be following a similar sense. Okay, so at this point, I'm going to hand over to my colleague Jamie, and then I'll get to say goodbye to you or answer some questions at the end. But yeah, thank you for listening to the first half.
Good morning, everybody. My name is Jamie. I'm one of the operational leads for the mass vaccination pods. So myself and Kirsty will be looking after 2 or 3 pods each across the areas that Kirsty's already outlined. So if you could just next slide, please, Jane. So from a volunteer's point of view, obviously there's a lot of volunteers from all sorts of organisations that we are working with as partner organisations. So the dress code where we ask all volunteers is a black or navy trouser, a white or a cream top, black or navy jumper or cardigan. And at the moment, so we will be providing, organisationally, we'll be providing everybody who's working inside the building with a high-vis jacket, which will go over your own top or jumper. If people choose or will be working outside as front of house or marshals, we'll also be providing a green polo top, green fleece, and also we're in the current ordering some high-vis jackets and high-vis coats that we hope will be in stock very, very soon. Next slide, Jane, please. Lovely. So just to go over some of the health and safety stuff that Kirsty has already touched on. So if people turn up to a vaccination pod, but obviously we're asking people not to attend any pod if they've got any suspected or potential or confirmed COVID-19 infection. So some of that stuff will be dealt with by the marshals. So we're looking at temperature scans and taking people's temperature on the way into the building to make sure people don't have a high temperature above 38 degrees, in which case they'd be asked to obviously leave the building and come back at a later date. I think one of the questions that came up in the chat a moment ago, so we're asking people to attend the vaccination pods by themselves where possible, so to minimize the amount of footfall that's coming through the building. Obviously, if people are frail, they're in a wheelchair, they have mental health issues or other disabilities, it will be possible for them to come in with one more member of their family or carer or support bubble. That will mean obviously a maximum of 2 people per person. So what we don't want is people turning up with children, grandchildren, etc., etc. So one of the things we do say, as Kirsty touched on earlier, we're not the police. So in terms of medical exemptions around face masks, you know, we have to take as read really. If we ask a member of the public that's coming in to the building to say, you know, would you mind wearing a face mask, and they say they're exempt, then we have to take that at face value. The same, obviously, if people coming in twos as opposed to ones. And obviously, when people come in, there will be hand gel facilities for people literally as they come into the building, and all the way through the building and through the patient experience and through the patient journey, there'll be hand gel, face masks for people who might need extra face masks, etc., etc. Next slide, Jane, please. Thank you. So Kirsty's already said, so when we're in the vaccination pod, we're looking at a 1 metre social distancing. So we take the pods at the moment, obviously we've all gone into tier 4 over the last couple of days now, but in theory, the pods are not COVID positive sites, so we have to bear that in mind. So, but equally, we have to make sure that we maintain social distancing where we can, and ensuring that everybody that's coming in, if they're not exempt, keeps a minimum of 1 metre social distancing when people are in pods. And from a staffing point of view and from a volunteer's point of view, when you're on break, or you've got a tea break or you've got some time off, we're saying 2 meters where your PP has been removed. So if you're more than 2 meters apart from each other when you're getting a cup of coffee or getting something to eat, it's a minimum of 2 meters when your PP has been removed. And obviously from our point of view, eye protection, face masks, gloves and aprons are all available across the pod. And equally, if anyone has had an adverse reaction to the vaccination, then that's available there as well. So hand hygiene, we touched on that already, but hand hygiene, obviously effective hand hygiene is paramount. So we've got gel, there's gel, there'll be gel and hand gel across all pods, plus or minus soap and water. So there's plenty of sinks available. So sinks and gel available. And as per government instructions at the moment, both from a patient point of view and a staff point of view, we're asking people obviously to avoid touching their face, especially eyes, nose and mouth through the day, basically, and also to make sure that we wash hands. Some of this is obviously common sense, but when we're going to the toilet, and the same for staff and the same for patients, so before and after eating and using the toilet, to make sure we wash our hands and use hand gel as per the World Health Organization guidelines. Next slide, Jane, please. Thank you. So in terms of in between each patient, so within each pod, we're expected to vaccinate approximately 540 patients per day when the pods get up and running at full steam. So obviously in terms of people sitting down, touching tables, touching surfaces, we need to make sure, and staff will be aligned to these particular jobs, that chairs and table and surfaces are wiped down between each patient. And obviously in terms of the pinch points and the high touch point areas, door handles, etc. I mean, we're lucky in Stevenage, most of the doors are automatic, but obviously in areas like toilet doors and entrance doors, we'll be asking people to wipe down those doors on a more frequent basis. And then at the end of each day, there'll be a deeper clean to include floors and other areas of the pod. Okay, so that's it from us. If there's any verbal questions you want to ask us, I know there's some questions that are in the chat at the moment, but if there's any questions you'd like to either ask myself or Kirsty, please feel free.
Right,
Okay,
hello everybody.
Jane, can we hand back
I'm-
over to you? Just obviously because I know
Yes,
you're going to
I'm-
head
I'm
up,
here.
and
I
there has
don't-
been a few things picked up in the chat box. So
Yes,
lovely.
can you? You can see me, everybody. Hello, everybody. I'm Jane Trundle.
Jane, we can't hear you, lovey.
Oh, okay.
I can.
Oh, I don't know
can't.
why.
Oh, sorry, it's me. Sorry, it's
I
me.
can
It's
hear
me.
you.
So I've just been looking at the questions. I can see that the biggest question is about training and being able to do your training. And reminder keeps opening, so just ignore me when it keeps beeping. I think that's the main difficulty. We've been using the e-learning for healthcare, but I appreciate very much that it's quite difficult to use. I'm going to share my screen again so that you can have a look. If I can show you where it's been, I can see that some people have managed it. It's quite difficult, I think, and I do appreciate that it is healthcare e-learning. If you have done this training in your day job, we're very happy to accept it. We've tried as much as we can to keep the training that you need to do to as little as possible. But we think that these things, particularly around confidentiality, around your own moving and handling as you're moving people around safeguarding adults, and around hand hygiene, infection control, are the most important ones for you to do. Obviously, once you're in there, you can do anything you want to, but those are the ones we'd particularly like you to do. So share. So you'll have seen from the list that has come across from, I'm just checking that you can see this.
Yeah, that's all good,
see
Jane.
that?
Yeah.
Okay, so you'll see when you go into e-learning for health that the first page has this, the link then goes to the coronavirus. Usually e-learning for health, you have to register and you have to, so you have a username and password, and they check that you work for the NHS. As part of the coronavirus response, Health Education England have made a lot of e-learning available for staff, for people generally. So if you click on this link, it will take you to a page that looks like this, and then a further link in here to where it says we've removed the requirement to register and please go in here. Once you go in here, I'm just making sure I'm on the right page, it takes you onto this page, and then if you click on view, you'll end up on a page that has all sorts of e-learning on it. Let me go back into this one so you can see it. I think what we're going to do, because it's quite difficult to find the individual sessions that we've suggested, they don't all sit together in one place, is that what we'll do is we'll send you out the links. Lisa, you've done that already with the links for the individual sessions?
I have sent the links, I believe.
For the individual sessions?
I'll have to double check, Jane. Sorry, I'll
Okay,
have to check
we'll
what I've
we'll
sent.
make sure that we
No,
send you. Hello, Gordon.
Yeah, we've only been sent the link to the e-learning, and as the person who's coordinating all the volunteers, that's one thing I sent to Lisa this morning. Can we have the individual links for each session?
Yes,
please?
we'll get that sorted out, Gordon. We'll get that sorted out today, and we'll send those across to you. I'll put together a little guide that says click here, etc., and with the links to the individual sessions. I think I hadn't realised that they're on all sorts of different pages, so they're not all together in one place, but we'll get those sorted and we'll get those sent across in a Word document with the instructions as well. So we'll get that done today and we'll send it out to you.
Thank you.
Okay, so I'll stop sharing there. The other question then, Kirsty and Jamie, there was a question about whether volunteers are able to will get the vaccine beyond when they would normally get it.
Sorry, Jane, can you just repeat that? Sorry.
Will volunteers get the vaccine as part of their volunteering role rather than when they would get it as part of their member of the population?
So the discussion that we're having at this moment in time, and what had been said previously, was obviously you'd be considered as working as with us essentially as part of the NHS, because you would be delivering obviously one of our services in effect. again, we'd need to completely clarify that, but I know that it was discussion point again raised with the previous volunteer, and that was obviously the discussion that we had with Sarah Brown, who's our chief nurse and quality lead. So we'll confirm 100% back to you, but where the state of discussion had got to previously was whether you'd be considered as part of our NHS staff group. And obviously we've got the over 80, just to be really clear there. So the over 80s and then health and social care staff are in the first cohort of the prioritisation.
Okay, thank you. I think you might have answered this already, Jamie, but a question about where the carers go while the member of the family or the friend is actually in the hub. Is there in the pod? Is there somewhere for them to wait, or do they wait in the car?
So if they're coming in as an individual, then the carer or member staff or member family will be expected to wait in the car. If they need obviously assistance, then that member of family will be able to accompany them around the pod.
Thank you. And an observation rather than a question, but an observation about the number of people that an individual coming in for vaccination will be passed between, relative, for example, to the blood transfusion, where that's been narrowed down to you only meet with one person who takes all your details and does the vaccination.
Again, just because we're saying this has been a national model, those changes haven't happened yet with the COVID-19 vaccination. So the process would be that you would come in, you would have one point of contact in terms of a qualified staff member in the clinical assessment, and then you would go through and it would be somebody different who did your actual vaccination. And there's no changes at this moment in time nationally to that model.
Thank you, Kirsty. There's a question from Dee asking whether we'd had any learning so far from the rollout of the vaccinations in the GP practices.
I think it's something that we have been intently got our eyes on. Obviously, we haven't been leading the rollout in the GPs. They have been, obviously, the primary care networks have been doing that themselves. We have had some of our staff, our clinical staff, supporting on a few of the days up at Lister Hospital and a couple of the primary care networks, and we are hearing lots of learning back from that, listening to it and thinking about how that would apply in our own pod sites particularly. And I think some of the learning that we are picking up, just to pick up there, is we are identifying things around in GP practices around queues, particularly outside management of patients, which obviously actually our pod sites cater for quite differently, just purely also from a size basis and how we've got movement of people through our pods. But yes, definitely, this is a learning process for everybody, and not just from when our processes start, but from what we're hearing and seeing around us.
Kirsty, one of the other things, as somebody who's supervised the recovery area, is the throughput of 540 is fantastic, but what they didn't consider necessarily sometimes with the GP surgeries is that 15 minutes that they have to wait means that you have to have a space for those people for 15 minutes. And one of the things that we were very certainly I was very hot on is that if you ask me to keep somebody or ask people to stay for 15 minutes, you don't rush them through that 15 minutes if all of a sudden you get some more people coming who need chairs. So I think that was the sort of pinch point for some of the vaccination areas.
Yeah, and I think really valid point there. And I think how we are quite fortunate, especially at this site, and obviously we'll be looking at how other sites will work as we take them on, is we have spaces where we can hold people essentially and put additional chairs out in holding areas. Make sure obviously there's a safety mechanism and keeping people for that allotted amount of time. We are lucky because we have them inside the building. I know at some GP practices they have been outside in sort of pop-up tents and marquees, but we are quite fortunate that we've got them inside. And again, the whole patient flow element that we were talking about so much earlier is that point that we can obviously slow the process down or speed it up accordingly to ensure safety measurement isn't lost.
Kirsty, may I ask, the plans that you showed of the assessment areas are very good, but are there any plans for the car parks? We've been having trouble with the age of people that are driving in, being slow and not being able to park perhaps as diligently as a lot of us could, and also a drop-off area. Has that all been taken into consideration?
So one of our other clinical leads has been working quite heavily with the on-site team here in Stevenage, specifically about car parking last week, purely because we see that as our very first point of contact to get right, because if we have a hold up there, we're obviously going to bring that on to the rest of the process. So we have, obviously it's barriered, so we can control the flow at that point in time already, and then we have 2 points of direction to take people, so we can take people nearer to the front of the building who are more frail or have additional needs, and then we have obviously a much larger car park that we can take people to, but we are looking at spacing out our outside marshals to support people in making sure that direction is kept and not lost, and also that we're identifying if people have additional mobility needs, that obviously we can direct them closer to the door, so that then they're obviously not slowing down the process.
And the
Lovely,
other
thank
thing, sorry, another thing just to add to that is we will have wheelchairs, accessible wheelchairs within the entrance part of the building. So if we need anyone to be dropped off, and then, you know, from a marshalling point of view, that person needs a wheelchair, we'll have wheelchairs available.
Can I ask about this vaccine? It's Nick Willis here. Is that okay?
Yeah, go ahead, Nick.
Carry on, Nick.
Yeah, the initial email that came out from Beth Bomer of the Bedfordshire Borough Council Community Hub did indicate that the vaccine would be available to volunteers. I assume this is because with 540 people a day or thereabouts being vaccinated, that's quite a lot of people one's interacting with, probably more than one's interacted with in the last 9 months. So there's presumably a high risk, and therefore that is the reason for it. So there seemed to be some, earlier on you said you weren't sure, there seemed to be some discussion needed. I think it's quite an important thing to clarify before volunteers start queuing up in great numbers. People want to help, but they want to know that they're also going to be as safe as possible whilst helping.
Yeah, completely agree with you, Nick. I just don't want to give you a falsified piece of information that then obviously is taken back. So I'd much prefer to 100% get the clarity of that response to then.
I understand, Kirsty. It's a little bit late for that comment, on the basis that I imagine Beth's email probably encouraged people to come forward, thinking that they were going to get the vaccine and really then happy to help the rest of their the citizens. And now it's cart before the horse. I don't know, but that's my concern.
No, and apologies if it's come across that way, Nick, and it's not meant to. It's just obviously I want to make sure that we're giving you absolute clarity, because if I immediately then say yes, you're all going to be vaccinated, and then that's not the case, we just need to be really clear that there's been no other changes to the intentions there.
I'll just jump in as well, just to say, once that conversation has reached a point, then if I could be included in the loop on the comms on that, and I can make sure that I get the message out to everybody here today and on the volunteer list, just to clarify that.
Yeah,
I think
100%,
as well,
Lisa.
I think as well, because the vaccination is in limited supply as well at the moment, just to add that, it's about making sure that we are working through that priority list as effectively as possible. And yeah, if we can get a consistent message on that, then I'll be happy to be the conduit to feed that through to everyone.
Yeah, at least we'll get that today, and we'll get that across to you.
Wonderful. Thanks ever so much.
Okay, so there's I'm just going to answer the question that's for me about first aid, about post-vaccination support training. This is basic life support AED training. So if you are first aid trained, we don't need you to do anything else. And I'd be grateful if you'd let Lisa know that, so that I think Lisa will be talking. You've seen what the roles are now, so it's helpful now to start thinking about what roles it is that you want to volunteer for. If you are interested in volunteering for the post-vaccine support, if you let Lisa know, and we'll be back in contact with you. So there are 2 bits of extra training, one which is around anaphylaxis, which is e-learning, and then the second is the basic life support with AED. And that's made up of 2 parts. There's some e-learning, which is the knowledge-based bit where we give you information. And then there's a virtual session with our trainers that our trainers have developed over the last 9 months, where they will demonstrate to you in a video call, and then ask you to demonstrate on a pillow, so that they can check you've got the timing and the depth, etc. right. You don't need to come in for basic life support training, but once if you give your name to Lisa, we'll be in contact with you and get you booked into one of those sessions so that you're then in a position to do the post-vaccine support. I know there are a couple of people in there who are very generously offering to do that, so that would be great.
Lisa, do you want all the ones on my spreadsheet? Do you want them to contact me because they
That would
should
be
have
good,
all,
Gordon. Yes, please. Yes, please.
rather than Lisa get inundated? So
Yeah.
anybody on the list that from Blevik and the Rotary and the Beds Community Volunteer Scheme or Community Action, if you want any of those, let me know, and I will.
We'll get some training set up for you.
Yeah.
Thank you.
That's lovely. So a couple more questions. Question about testing. So will volunteers be required to have regular testing?
The answer to that question is I don't know, if I'm being totally honest. I think it's one of those things, again, we'll take away, because in terms of lateral flow testing, whether or not people need testing every 3 or 4 days, as some of the NHS staff are now, I think an ideal world, the answer to that question would be yes, but I think it's something, again, that we'll take away and come back with an answer to yourself, Lisa, probably hopefully by the end of the day, if that's okay.
That's great, thank you. And a question about timelines. Do we have any idea now of the timings and the timelines for volunteering?
In terms of timelines, so I'm very conscious that we're dealing with two sort of separate buckets, if you like. So there's the community-based vaccination centres that colleagues have been talking about this morning. And I believe you've got a rostering process or a rota process in train, haven't you, where people are signing up to rotas through a particular process your end. We are going to be filtering people through to that system, but also I'm working with the GP surgeries in their primary care networks as well, so we'll also be diverting some people through that route. So the timeline for that route is that we're having GP practices coming to me now who are ready to mobilise from the 4th of January. And then we have another tranche who will mobilise on the 11th of January, and it's sort of phased. So given that people have completed their training at this point online, attended this induction this morning, I'll have a record of all of those people. So those people will start putting through to yourselves in the community setting, and equally the primary care networks, depending on where the need is. Some GP surgeries have been sourcing their own volunteers as well, I found out this morning. So we are sort of the central point of contact. We will be requesting where the urgent gaps are and working to make sure this side of Christmas we know who needs to be deployed on the 4th of January and for the 11th of January. So we'll be working with individuals to start getting those rotas built up.
Okay.
I hope
And
that
there's
helps.
just a final, there's a couple of other general questions I think in there. There's one about parking, and I think what we've said to you about volunteer parking is about what's happening in Stevenage, but obviously that will absolutely be in our minds when we're looking at other pods about where volunteers will park, and we'll be sending you information about that. And there's also a question, Jamie, I don't know if you know the answer to this, about knowing what additional languages volunteers speak.
Sorry, you disappeared there, Jane. Say that question again.
A question about understanding what other languages the volunteers speak.
Yes, I think that's something that we need to capture, and it's certainly something we haven't thought of, I think, previously. That it'd be very useful to capture every volunteer if they speak an additional language, so that obviously we can look at that from a pod point of view. And I think I don't know whether, Lisa, that's something maybe you would have that information or not, or whether you could ask that question of each of your volunteers.
Yeah, we have been collating. We haven't explicitly asked people what languages they could support with. But some people have offered that information, so we are starting to record it. I think if anybody on the call today hasn't declared that they could help us with additional languages, then do drop me a line either in the chat box or via the COVID inbox so that we can record that and support where we can with that.
Can I just clarify, because whilst I've been on here listening to you all, I've contacted the named people that I needed to get the clarity on whether you guys would be receiving the vaccine as part of our group, and the answer is yes, you would. We would take into account that, as I said previously, you are our staff group and considered equal to our health and social care staff, so you would have access.
And again, if people, rather than sending lots of emails, if they want to add into, if they want particular posts, if they want to put in languages into my email address that I put up on the chat, I can collate those for Lisa as well.
Okay, I'd seen in the chat somewhere that some people have already expressed an interest in their roles. I think this is just now you've seen the information that we've given you about what the roles are. You may think there are other roles you might be interested in getting involved in. So if that changes, I think the thing to do is to let us know. So I think that would be great. So
I think, sorry, Jen, all I was going to add to that is obviously there's a bit of ambiguity, as we said, about the word marshal and front of house. So I think if people expressing an interest, if they could just make it clear whether they're inside or outside as part of that decision-making process, that'd be really useful.
And just to add to that, we're conscious that, you know, we are in winter, so that's why we're asking for 2 roles essentially, because what we want to try and be able to be in a position to do is rotate people and almost pair you up with somebody who's working inside is the ideal, to then work at swapping over so that you're not necessarily outside for that length of time. And obviously we'd be encouraging warm clothing and boots wear as warm as you can be essentially. And I know Jamie touched on the provision of fleeces and etc. earlier.
Okay, there are some questions about hours and shifts, which Lisa, I'm not sure we're in a position to answer at the moment, are we? Or do you have some information?
What sort of questions are you getting? Sorry,
what are the hours? What are the
through.
shift? What's the shift pattern? How long is the shift? I think, Eva, is that how long is the shift? Okay, so just.
Okay.
So in terms, oh, sorry, go on, Eva. Sorry.
Sorry. What times do we start? What times do we finish? What are the shifts? How long are they? Saturdays, Sundays, weekdays?
Okay, so I can tell you in terms of, and then Lisa, you might want to piggyback onto this if there's any specifics from your side. But in terms of operational hours for ourselves for the delivery of the pod at this moment in time, so we're running an 84-hour week, which is basically 7 days a week, Monday to Sunday, and they're 12-hour days. So, but we're not expecting everyone to do 12-hour days, of course. So it's 8 o'clock in the morning till 8 o'clock at night, and then we will have some of our staff doing 8 o'clock till 4, and then some people doing the 12 till 8. But I know that obviously from volunteer groups, I understand that sometimes it might be that you work in 4-hour blocks. So it's also down to yourselves as a group in terms of what you're expressing that you're happy and able to do, and us trying to jigsaw puzzle piece everybody together to get the cover that we need over the course of a day and a week. Lisa, have you got anything to add there specifically?
Nothing specifically, Kirsty. Thank you. I think you've answered that in detail. In terms of the jigsaw puzzle piece is exactly how we're anticipating working it. So we'd look at a minimum of 4 hours, I think, because rotoring just becomes a little bit more challenging if anybody's offering anything less than that. So we'll go sort of on a 4-hour minimum, but people have really helpfully put through their availability on the forms that we've been asking people to complete up to this point. So we will work with individuals to do that jigsaw piece filling in order to fill out the rota gaps. And GP surgeries are much the same in terms of their hours. They are also 8 to 8, 7 days a week.
Okay, and I think the final question then, Lisa, and I don't think we know the answer, this is about start date, and we're likely to, when the volunteering is likely to start.
Well, any urgent requirements this side of Christmas, we're managing through Gordon and colleagues with Blevik. So we're taking an emergency volunteer approach to managing those. But looking at starting from the 4th of January, we really need to start talking to people this week about starting our rotas for GP surgeries. starting on the 4th of January. So we'll be in touch with people that have logged on here today. And I'm not sure what the system is in terms of how it's working your end. I assume perhaps you've already got your rotas for next month, have you?
No, not at this stage entirely. Again, we're still jigsaw puzzling because obviously we're unsure at this moment in time how many pods will come live, over what pace, and what the ask is nationally of us at this moment in time. As you can appreciate, there's been quite a lot of movement with that, and also in accordance with how PCNs are coming on board particularly, but also obviously tier 4 having its impact as well. So yeah, we're awaiting clarity on definitive dates and number of pods, and obviously that will in due course impact how many people we need, but as soon as we get that information, obviously we've got people like yourself, Lisa, that we can communicate that with timely to help us address the rostering.
That's great, thank you.
I think the key thing that would be really helpful, to be honest, is really knowing demographically where people can work. So as much as the roles, it's knowing demographically. You've heard today, obviously working across quite a large patch area, and I know you will all be spread in terms of where you live, but thinking about the West Essex, Hertfordshire and Bedfordshire and Luton and Milton Keynes areas particularly, if we know whether you're just designated to one of those demographics or whether perhaps where you live could neighbour two that you could go to, it would really help us when it comes to rostering massively. Can't stress that enough.
Kirsty, our spreadsheet actually says, are you available for Luton, Central Beds or Milton Keynes? And in fact, the original one for Blevick actually cut it down even further than that. So that is all on the spreadsheet that Lisa has access to.
That's brilliant, Gordon. Thank you. Honestly, as much detail as can possibly be shared at this point, it really does make it easier for Lisa and ourselves working together. So thank you.
Oh, and we did add Stevenage in when the request came in.
Brilliant. Very kind.
I'm just going to hand back to Lisa. I'm just emailing. I'm just messaging Louise. I'll just turn back to Lisa just for you to finish us off. So that would be great.
That's brilliant. Thank you very much, Jane. So big thank you to yourself, Jane, to Jamie, and also to Kirsty for the information that you shared with us this morning. I know I've also personally found it very valuable. And a big thank you to everybody who's helped thus far in terms of sending information through and coming forward as well to help, as Kirsty described at the start of the session. And this programme couldn't run without the support of volunteers. So a huge thank you. And after the session today, we will be in touch about starting to fill those gaps in rotas and working with you on what you're able to offer in terms of support, where that will be, and the roles that you anticipate filling. So we will be in touch in due course. So thank you ever so much. Oh, are you on mute, Jane?
Thank you very much, Lisa. Right, everybody, I'm just going to close the meeting now. Thanks very much. Goodbye.
Thanks,
Thank you,
everybody.
everyone.
Thank you.
Thank you.
Stay safe, everyone.
And you.